Hi, I'm Gary Bebow, CEO of White River Health System, and this is the September CEO Connection. With me today, I have Christy Wyatt, who's been at the hospital for 19 years, and Penny Wright, who's been at the hospital for 26 years. They've been working with me ever since March of this year in evaluating our standards of behavior, trying to take a look at them, whether they're still applicable to us, and were there some improvements that we should be making to just make them better. So we're going to talk a little bit today about that process and what we got coming up in terms of rolling out the new standards. So ladies, we started in March. We had a really pretty good team, didn't we, that worked together to make this happen. And I want you to give us a list of who those people were and anything about them they might want to add to us. So.
Well, we broke the teams into two and kind of split the task between the two teams. And on my team, we had Angela Adams, Sarah Collins, Darlis Williams, and Marcy Douglas. And we worked on the policy that went along with the standards of behavior and are helping to prepare the rollout celebration as well.
And on my team, I had Angela Adams, Sarah Collins, Missy Drake, Brandy Fagan, and we worked on the actual PRIDE standard.
So basically, we've gone away from the standards we have right now, and we're going to use the acronym PRIDE to help us all remember what those standards are and kind of sort of help us keep it front of mind. So what does PRIDE stand for?
PRIDE stands for prompt service, respect, involved, demeanor, and environmental focus.
And so we also have some specific behaviors that we're going to associate with each of those letters. And so when we do the rollout, when are we going to do the rollout, Christy?
We're going to do 3 different sessions of a rollout. The first will be on September 22nd from 11 a.m. to 2 p.m. And then we'll do one in the evening, that evening from 6 to 8 for the evening shift people and the folks as they change shifts. And then we'll also do one on the 26th, which is a Saturday, from 6 p.m. to 8 p.m. for the weekend folks.
So we're going to have celebration.
Yes.
And you got some surprises probably ready for us at that time to really bring life to the new program.
Right.
So we'll have some specific examples of what we want the employees to do to live the standards.
Right.
And then we're going to have an ongoing process to reward and recognize those standards and really help us all to be better, aren't we? Ultimately that's our goal, is to be better. I can't tell you how much I appreciate both of y'all's help in this effort. I really think that it's been a great committee. I've said over and again, you know, that the group has been so engaged. They're all really high performers here at the hospital. In fact, that was one of the criteria we used when we put the group together, was that we want to have the highest performers we have in the institution. And boy, I can tell you for sure we got them. So I'm looking forward to all the staff coming to our rollouts and really get engaged in our new standards behavior. So we'll see you on the 22nd and the 26th. So thanks for coming in, ladies.
You're welcome.
Y'all done so great. Thanks, appreciate it.
It's a pleasure.
The standard of the month for September is appearance. You know, I got a cold. I got a sore throat. And man, I am so sick and tired of this appearance. But up and beyond that, the importance of appearance can't be overstated. You know, when I go to other organizations, or whether it's restaurants or hospitals or just any place I go to, I always am really particular in how the appearance of that institution looks. And it leaves a lasting impression on me for sure, and often makes a difference on whether I go back again. And so just like other organizations, we have that same responsibility here to present this hospital and ourselves in a positive way so that people not only come here and use us one time, but they continue to use us for their future healthcare needs. So during this month of September, I really hope that you'll pay close attention to appearance and do your best to improve the institution's appearance, but also yourself as an individual. So thank you. We have 2 excellent employees for Standard of the Month for Stone County Medical Center. One is Nikki Osborne, and the other is Kim Raymer. Both are out of Stone County Medical Center's radiology. Nikki has worked for Stone County Medical Center for a total of 6 years. Kim has been with Stone County Medical Center for 10. Both were being recognized at Stone County for their professional and courteous behavior, and please join me in congratulating them on that recognition. At White River Medical Center, we have Doralis Williams from Patient Accounts, who was recognized for confidentiality privacy. Doralis was on the Standards of Behavior Committee that we talked about a little bit earlier. And I can tell you from my getting to know her over the last 6 months or so, she's well deserved of this recognition. And I really appreciate all the things that she's done on the committee and helped me in recognizing her for doing such a great job in confidentiality and privacy. During September, I want to recognize 2 new physicians who've joined the staff. Dr. Jody Chaudhry, an internal medicine physician, and Dr. Shailendra Singh, a rheumatologist, are both starting over in Dr. Walton's office. Boy, both of them are really badly needed in our community. We've never had a rheumatologist in the past, and so I can only guess on how busy he'll be. And at this time, particularly with Dr. Walton's discontinuing practice, we all look forward to Dr. Chaudhry starting as well. So they'll be in and around the hospital. I think they start on September 1st. And so when you see them, be sure to welcome them to the community, and let's do our best to get them acclimated and doing well quickly. On September 8th, our community health education event will be presented by Dr. John Lambert. Dr. Lambert recently went to a missionary trip in Peru. He's going to give us some firsthand experience on what the medical care is like in Peru and some of the great work that he's been doing down there. You know, Dr. Lambert's been on the staff as a general surgeon, actually since he finished his residency training, and I know that it will really be worth your time to come hear what he has to say, and you can have lunch out with us as well. Annually, we do a free prostate screening at White River Medical Center in the conference center. This year, on September 15th, we'll be doing that again, and we anticipate approximately having 300 people come through the prostate screening. We're always looking for volunteers, and so if you have an interest and have the time, we'd really appreciate you contacting our marketing department and letting them know of your availability. So September 15th, prostate screening. On October 6th, we'll have our annual Health First Women's Health Expo at UACCB. It will be from 4 to 7, and if you want to man a booth during that 4 to 7 time period, please contact marketing and we'll help set you up. So it's a big event for us each year, and it's a way that we can showcase our services to the community, and I'd really like to have you participate if at all possible. So that concludes our CEO Connection for September. If you have any suggestions how we can improve this in the future, please be sure to let us know. So thanks, and have a great month.